Thank you, Mr. Chairman. It's my honor to present in this today. Nothing to disclose. Laparoscopic distal gastrectomy was first reported in 1991, and recently this procedure is a standard procedure in early gastric cancer in Korea and Japan. Recently, several studies were published about laparoscopic gastrectomy for advanced gastric cancer. First, many people talk about the technical feasible and safe, but recently they also set up the good overall survival. So the aim of this study was to investigate the pattern of recurrence and compare the recurrence between open and laparoscopic groups, and to analyze risk factor for recurrence in gastric cancer. 398 patients who underwent radical gastrectomy with R0 resection for gastric cancer at Gyeongsang National University Hospital between 2005 to 2007 were analyzed. The operator was an expert surgeon who had experienced 50 cases of laparoscopic gastrectomy. Let's see the surgical procedure. In case of the open gastrectomy, we performed a conventional gastrectomy in total lumpectomy and T2 lymph node dissection in all cases. And we followed Japanese Gastric Cancer Association guideline from 2002 in case of the laparoscopic gastrectomy. In early gastric cancer, gastrectomy and partial lumpectomy and D1 plus better lymph node dissection was performed. But in case of the advanced cancer, gastrectomy and total lumpectomy and T2 lymph node dissection as the same procedure in open gastrectomy. Reconstruction was in case of the subtotal extracorporeal +1 or 2 using upper midline or right subcostal mini laparotomy. And if the cancer was located in upper extracorporeal end to side, esophageal gastrostomy, or wrong eye ejestomy by using a circular stapler. Data collection was a medical chart review and telephone interview. And let's see the result. The patient's mean age was 61 years old, and male to female were 2 to 1, and low SOD was 70%, and TNM stage 1 is 70%. Laparoscopic gastrectomy was 65%, and 70% were subtotal gastrectomy. We found about 19% of the morbidity rate, but only 2 cases of the mortality rate. We followed about 36 months, and we found 19% of the cancer recurrence. We compared open and laparoscopic groups. We found mean tumor size and retrievable lymph node, and case of the TNM stage 1, and longer operation time in laparoscopic groups, and case of the subtotal and total gastrectomy was different. Morbidity rate is low in laparoscopic group in early gastric cancer, but there's no difference between 2 groups in cancer recurrence. In case of the recurrence patients, similar in the total patients characteristic, but stage was half of patients was TNM stage 3, and 30% was stage 2. And high rate of the open method and high rate of the total gastrectomy. We compared 2 groups in recurrence site, and there is no difference between 2 groups. We performed the univariate analysis for risk factor for recurrence in gastric cancer, and we found the tumor size, large tumor size, and high TNM stage. and open gastrectomy and total gastrectomy were high risk for recurrence. But in multivariate analysis, we found only a high TNM stage was statistically significant. So we concluded no significant difference in recurrence between two groups, even in advanced cancer. So it is concluded laparoscopic gastrectomy was safe as open surgery, but further large-scale prospective study was necessary. This study has several limitations: retrospective, non-randomized short-term follow-ups, and small number of cases of the high TNM stage. But single surgeon and single institute and large group of the advanced cancer, and recurrence, 19% of the recurrence was diagnosed in the same hospital. Thank you for your attention.